first of 3 distinguished speaker presentations for the 2020 JES Digital Symposium, Power at Play. We are extremely excited to welcome Melissa, Cindy, and Paul, who are going to talk about the role of the coach in addressing athlete mental health. Melissa Otterbein is a certified health educator specialist currently working as education manager at USA Triathlon in Colorado Springs. Her research publications include Sport as a Tool to Address the UN Sustainability Development Goals, Sport for Development and Nutrition, a certified USA Triathlon Level 1 and US Master Swimming Coach. Melissa has coached a variety of athletes, including the differently abled, displaced, LBGT, youth, collegiate, adult, and female populations. She's pleased to have joined her 2 colleagues from her upcoming work on addressing athlete mental health, Cindy Miller-Aron and Paul Gorczynski. Cindy is a athletic consultant and provider in private practice from Portland, Oregon, working closely with the Oregon Health Sciences University Sport Medicine team at Portland State University. She was appointed to the NCAA inaugural Mental Health Task Force in 2013 and the International Olympic Committee consensus meeting on mental health in elite athletes as a content expert in 2019. Paul Gorczynski is a chartered psychologist and associate fellow with the British Psychological Society and a senior lecturer of sport and exercise psychology at the University of Portsmouth in England. His research expertise lies within the promotion of mental health and well-being in clinical education in elite sports settings. He also co-leads on a mental health and sport training program as part of the Sport and Exercise Psychology Accreditation Route organized by the British Association of Sport Sciences. And in 2018, he was an expert panel member for the International Olympic Committee consensus statement on mental health. And with that, I will allow Melissa to take over and.
All right. Well, thank you, Andy. So as Andy mentioned, I'm Melissa Otterbein, and as a distinguished speaker, it's not only my privilege to welcome you all to the Journal of Emerging Sports Studies Digital Symposium, Power at Play, but also to discuss the role of the coach in addressing athlete mental health with scholars Cindy Miller-Aron and Paul Gorczynski. As you may have seen from the conference program, the theme Power at Play aims to examine the ways that sport acts as a catalyst of personal and community empowerment, while also addressing and reinforcing societal power structures. When I reflect on the words power at play, one word at a time, I first consider the word power. Power is defined by the Oxford Dictionary as the ability to do something or act in a particular way, especially as a faculty or quality. It's one of the words I use often when I consider the value of sport. It has the power to change lives, Nelson Mandela once said. And I imagine most of us here at this conference would agree. But with power comes responsibility, and that's where the work of each presenter who's involved in this conference comes in. Through this conference, we have speakers like Catherine Sherwood, who called into our consciousness the systematic oppression of the Aboriginal people in Australia. And in doing so, through underscoring empirical and oral history research methods, is showing the power of sport in the lives of Aboriginal players in Queensland through rugby. We also have researchers like Andrew Bailey, who emphasize the importance of participant involvement to address power dynamics as we strive to measure impact in the sport for development sector. Through this conference and its session themes, we see the power of sport and how we can harness each of these contexts across the world. Beyond our scholars, we have engaged listeners and readers like each of you, who will continue to harness the power of sport through scholarship, community practice, participation, and leadership in sport. The last word of the conference theme is play. The UN Interagency Task Force on Sport for Development and Peace defines play as any physical activity that is fun and participatory, often unstructured, and in the case of children, often free from adult direction. Play is the precursor to organized sport. It's quintessential to our development, well-being, and freedom. We've seen this evidence in 2020 during the COVID pandemic, such as through the dramatic increase in bicycle usage and production. According to the South China Morning Post, Taiwan's top 2 bike makers have orders lined up until the end of 2020. EcoCounter found a 21% increase in US urban ridership compared with the same time frame in 2019. Play and physical activity continue to provide the fortitude to remain resilient in the individual and global challenges we're experiencing now, as it's done all throughout history. Clearly, Power at Play captures the essence of sport's importance on individual, interpersonal, community, and global levels. I hope you enjoy the 2020 Journal of Emerging Sport Studies Digital Symposium, engage with authors during the live presentations this weekend, and listen to each of the presentations available on the Journal of Emerging Sport Studies website. All right. Little technical difficulties, but I'm getting there. It's now my honor to introduce our research topic, which is what is the role of the coach in addressing athlete mental health? And I'm joined again, as you've heard, by 2 colleagues, Paul Gorczynski and Cindy Miller-Aron, who are going to introduce themselves now. Andy already gave us a kind introduction, but just also wanted to give everyone a moment to chime in with any additional details.
Cindy, do you want to go?
Sure, Jesus. All right, so essentially I'm a direct service provider. I'm a clinical social worker. I've worked in the space of elite athletes for 25 years. And I've primarily worked with Division I college athletes in the United States. And I've been very involved in national and international advocacy for mental health to be incorporated as an essential part of a sports medicine team. And my particular area of expertise has to do with appreciating and utilizing unconscious process to help athletes move forward with being free to do their sport. So that's a little summary.
And my name is Paul Gorczynski. I'm a chartered psychologist, Canadian trained and living in the UK at the University of Portsmouth. And a lot of my work has traditionally been actually within clinical work, specifically looking at the roles of physical activity and exercise within psychosis. And upon moving to the UK, I recognized that especially from a British context, there's so much to be said about sport as a vehicle to be used in health promotion. And especially after the 2012 London Games, a lot of things in Britain were really rooted within sport to help promote various aspects of physical, psychological, and social health. So for the past few years, I've really adapted my practice and my research to be looking within various sports environments, and the need for especially mental health literacy within sport was something that caught my eye. And that's where I focus most of my work. And since being involved with the good folks with this consensus statement that you see on your screen, we've put together some other wonderful pieces of work that are moving the field forward. So it's really nice for Melissa to reach out and to provide the invite for today's talk. I'm really looking forward to it.
Thank you. And I'm Melissa Otterbein. I know Andy already introduced us, but just briefly, I'm working as the education manager at USA Triathlon, and have not only coached a variety of populations, but continue to compete in sport myself. and also engage in research related to physical activity. Physical activity is a tool in sport for development, and really excited now to delve in further into research and implementing strong practices in mental health in sport settings for athletes to promote well-being. So what began as the research question, what is the role of the coach in addressing athlete mental health, quickly turned into a broader discussion from a systemic standpoint, from issues beyond coaching, such as the structural, cultural, national level challenges, and areas for interventions as I started to scour the literature. The most formative piece of our research discussion today will come from the International Olympic Committee's consensus statement on elite athlete mental health, which Cindy will talk about shortly. There's several other key pieces of research that will be discussed in this presentation, and all sources are available at the end of our presentation. Please consider this research as commentary that offers a path forward for coaches, clinicians, institutions, and national federations to consider in their implementation of sport. So, since we originally started with the research question focused on the coach, let's at least first dive into the impact of the coach. So when we consider the roles that coaches play in an athlete's lives, we need to consider the impact and power that they possess. You know, as the coach, they make decisions for the team. They have power to determine playing time. So a coach's role is very unique in that of their athletes. So they have a strong influence in their athletes' lives. They play many roles, not only, you know, could include a role model, it could be a mentor, could be a chauffeur, could be a listening ear if it's a coach who's really spent the time to develop a rapport with their athletes, but with healthy boundaries. And they do possess that considerable power and influence. They also can be used to minimize deleterious mental health consequences through early detection and referrals for prompt treatment. Coaches spend so much quality time with their athletes that they're in a strong position to be able to identify and get that referral process going if they have the education and awareness to do so. And coaches who prioritize athlete mental wellness can increase the likelihood that athletes will receive timely and effective treatment. So by knowing what to look for, coaches are then in that position to start helping that process happen more quickly. So as we delve further into how to shape the culture of wellness within sport, it's important to consider how we would even define mental health. Researcher Paul Gorczynski will delve into this further now.
One way to really think about mental health is to really just define it by the World Health Organization. And the definition you see in front of you there really situates mental health as a state of well-being. And there are certain aspects to it that are really important to note. For instance, it is something that allows people to realize their potential. It is something that allows them to cope with challenges in their lives. It is something that allows people to be productive, to be fruitful, to flourish. In essence, it allows them to make unique contributions to not only their own lives, but collectively toward the lives of others. And it's important to really have this basis of a definition for mental health as we move forward, not only in this presentation, but any kind of work that we do. Mental health is something that can be viewed as a resource, much like physical health. It allows people to do good work. It allows them to set particular goals for themselves. It allows them to deal with challenges, to make meaningful contributions. We're not always going to be in a state where individuals are always flourishing, are always able to cope with challenges or to realize our potentials or to work productively. We're not always going to do that. And there are going to be times when we are going to perhaps languish. And it's important to recognize that mental health fluctuates, just like resources do. And so it's important to use that within any kind of construct of a health promotion strategy, especially ones that are perhaps rooted in helping individuals realize their potentials and their abilities to make contributions to their communities. It's also important to think about other definitions that are perhaps elemental to not only this presentation, but again, any kind of health promotion strategy, and that's well-being. Now, when we think about well-being, it's something that contains positive emotions, positive moods. It can contain perhaps a recognition of the challenges and the resources that individuals face in their lives, be it physical, psychological, or social. But again, it's important to situate ourselves in this literature and be mindful of these definitions. All these definitions matter because we're also going to be talking about mental health symptoms and disorders. And these are kinds of changes in thinking, emotions, behavior that individuals experienced. And they're perhaps underlined by changes and that individuals will experience occupationally and socially and within various functionings of their lives. In this particular, it's going to be sport. And it's also important to recognize situations outside of sport. All these definitions help contribute to perhaps one of the more discussed types of promotion strategies around mental health, to not only recognize symptoms around mental health, but the way that we have carried certain attitudes around mental health, how we situate ourselves within a broader discussion around stigma, be it public or self, and also how we, in a sense, help structure intentions towards seeking support for individuals who may be experiencing mental health symptoms and disorders. And those are the three major pillars of mental health literacy. It's an ability to recognize symptoms, this knowledge, and the belief that there is an opportunity to go and seek support for mental health symptoms and disorders. So knowledge, attitudes, intentions form a big component of mental health literacy. And that relies on definitions of mental health, of well-being, of mental health symptoms and disorders, and understanding the basic premise of what a mental health promotion strategy might look like. Now, there are numerous factors to consider in terms of what might impact an individual's mental health. And you see the word ecological there and holistic, and it's there for, those two words are there for good reasons. It is important to recognize that there are multiple factors acting upon individuals with regards to their mental health. And with athletes, it's important to also recognize that there are lives that exist outside of athletics. So the holistic life perspective takes into account individuals' lives before, during, and after they're athletes. And recognizing that this is also situated in a broad ecology that the person is occupying. And within this, we can think about factors operating at multiple levels of influence. So for instance, we have the individual and intrapersonal factors that are impacting an individual's lives. We can think about interpersonal factors, so how individuals situate themselves in relation to others and how they operate within larger systemic groups. So for instance, the depth and the size of networks that people have access to and how those relations continue. We can think about this more broadly in terms of an organizational perspective. So in the case of an athlete, what's happening on the team or the squad, or perhaps within the actual organization that person is in. We can think about the broader sporting community. So what's happening perhaps maybe with, say, the Olympic community of, say, athletes, or perhaps individuals who occupy an entire sport. And then we can go even bigger than that. We can think about national and international policies that are impacting individuals in terms of their mental health and their well-being. So there's a lot of factors to think about. And it's not just single factors that are impacting an individual's mental health, but this symphony of factors that work in unison. And so what you see before you are just a number of factors to take consideration of. And these are the kinds of factors. What? Should have turned off my phone. That's how embarrassing. I don't even know where I was, but I think the point that I was trying to convey is that there are so many factors to take note of, and it is a complex situation. There are multiple factors. They're all working within a particular broad ecology, and so what you see in front of you are just a number of things to consider. And one thing to perhaps note when you are perhaps looking at literature about studies that are addressing mental health, one thing to take note of is the diversity of factors. And I encourage you to almost make a little chart for yourself when you are reading these papers, because what's happening is that a lot of these factors are just not mentioned. And one thing that perhaps is important is to recognize the diversity of athletes that we're dealing with. So there are a lot of factors to think about, but these are some perhaps that have been noted most prominently in literature in terms of impacting individuals' mental health. And just like we were thinking about individual level factors, we can also think about some of these in operating in other areas of the ecological model. So various stressors that are coming at the athlete from interpersonal relationships. We can think about particular team dynamics or low levels of support. And again, this is where perhaps we might start thinking about these kinds of relationships, and perhaps where most importantly, the coach comes into play, and how not only those team dynamics are situated and how they are actually organized and perhaps how they can be improved, but also how athletes are working together on a particular team. There's other things to think about as well as the athlete matures. So for instance, how is retirement actually viewed? Is it something that can be planned for? Or is it perhaps more sudden and unexpected that may accompany a particular injury? So these are the kinds of things to think about. One other thing to really take note of is that there is a considerable amount of work that's coming out, and Cindy has played an incredible role in this, especially with Margot Mountjoy, is within the development of non-accidental violence within sport, and the kind of prominent role that harassment and abuse play in terms of really impacting the mental health of athletes in a number of different ways, be it physically or psychologically, or also through perhaps neglect. These are some of perhaps the most prominent factors that you'll see in the literature that are impacting the health, the mental health of athletes.
So next, we want to consider the theme of intersectionality, which may be a term that many listeners, viewers, scholars who are engaged in this symposium are already familiar with, but it's worth noting and reinforcing. So intersectionality, as you can see from the definition on the screen, is the complex, cumulative way in which the effects of multiple forms of discrimination, such as racism, sexism, and classism, combine, overlap, or intersect, especially in the experiences of marginalized individuals or groups. This image on the right comes from the American Women in Science. And when we're looking at intersectionality, it explores things like privilege, domination, power, oppression. And it's important to consider that our elite athletes, or athletes in general in sport, not only have some of the other factors that Paul was just sharing, but they also may be already predisposed to discrimination simply because of their race, their sex, their class. And so it's important for us to consider that this could pose additional challenges in athlete mental health. If it's, someone who's already experiencing, based on their own, ability level, skin tone, gender discrimination on top of the challenges that may come through sport, it could really illuminate the need for us to take a very active approach in providing supportive environments for our athletes and those we coach in sport. So then we want to consider, well, what are the barriers to disclosing mental health from an athlete's perspective? And this research came from University of Toronto, a researcher named Jamie Bissett. She interviewed athletes and uncovered 5 key themes that athletes shared when, describing their barriers to disclosing. And these included traditionally tough sport cultures. So the idea from a cultural standpoint of sport that you got to be tough, if you have a mental health concern, maybe you're going to be perceived as weak.
Mm.
Then there was the power of coaches. So coaches already have such a strong presence. They already have power because they are decision makers for the team. So, you know, how does that fear maybe of someone who's in high power make someone feel welcomed to share a concern with their coach? Then an athlete's previous position on the team, you know, so say they were the star athletes and now they disclose a mental health concern, they may fear, you know, that their time is done in sport, and they may, you know, be hesitant to ever want to come back. Previous negative experiences with disclosure was also noteworthy. And so if an athlete already tried to share with either a coach or someone in the athletic administration and they had a poor experience, they might say, you know what, I just can't talk about this in this sport environment. And maybe they're going to bottle it in, which could only make it worse. And then poor visibility of psychological distress. You know, the idea that it's really just not talked about, that, you know, it's somehow over there. You know, we can't talk about it in sport. So why would I disclose it to my coach? So as more research and discussion around mental health enters the public sphere, it's important for coaches and the greater sport community to understand the unique challenges that athletes face, not only just from being an athlete, but also maybe the intersectional approach of other forms of challenges they may experience in their own lives, while we also try to create solutions for fostering healthy sport environments. There have been several advances in understanding and bringing awareness to athlete mental health, in particularly with elite athletes, which we'll now discuss with one of the authors on the International Olympic Committee's Mental Health in Elite Athletes Consensus Statement. So I'll turn it over to you, Cindy.
Thank you. All right. So I, first of all, would encourage everyone, this is available online for free. I would encourage everyone to read this document, as it's just filled with so much amazing information for people. And essentially, just to give an overarching perspective on consensus statements by the International Olympic Committee, they first began putting out consensus statements in 2003 on particular issues, medical issues that came up and were worthy of doing research on and making a statement about in athletes. And although, trust me, I'm completely thrilled that in 2018, we were able to put together the consensus meeting. It took 15 years for mental health to, in a sense, be something of consideration. And that's no reflection of the IOC. It's a reflection of where mental health is in our culture and the kinds of things that Melissa and Paul talked about. And if one looks at some of the other consensus statements, in many ways, they're very specific, like, for example, pregnancy in sport. Well, when we think about the numbers that way, it's very small. And yet mental health, honestly, is an issue for every single person who's alive, because it has to do with our entire being and physical health. So I think we need to continue in terms of thinking about, like what Melissa and Paul talked about, that we're wanting to shift the overarching culture of how mental health is viewed. So essentially there's the consensus document, and then there are 11 subspecialty papers, of which mine is one on 11 topics where there's virtually no literature. And my particular area of expertise is PTSD. So in any event, the task that we were given as a group was to review the literature and then look at describing and establishing recommendations, both medically in terms of pharmacology and psychotherapy, and then to provide recommendations on how to minimize the negative impacts of the sport environment on mental health symptoms and disorders. All right, next slide. So essentially, these are some of the results, just a quick summary, that mental health disorders occur in 5 to 35% of elite athletes over a period of up to 12 months. So there's evidence that these symptoms and disorders are likely more common in athletes, and these are eating disorders, some substance use disorders, attention deficit, and gambling disorders. And then there's evidence that suggests that these symptom disorders are probably as common in the general populations, certain sleep disorders, anxiety, compulsive disorders, and panic disorder and PTSD. But again, there's a paucity of research, so we aren't really sure. We're just starting with a baseline here from which to move the field forward. Okay, next slide. So risk factors unique to sport. It was very interesting to me, the first one, severe musculoskeletal injuries. In the research that there is, not just related to athletes because there's so little, but also just looking at injuries with the general population, the development of psychiatric symptoms post-injury. I mean, one doesn't want to say always, but it's almost like there's a straight line between a severe injury and the development of mental health sequelae post-injury. And so I think this is essentially been quite under-recognized in sport and needs to be paid more attention to in terms of earlier interventions with athletes around injury. So another interesting part, there is a lovely article on this that's well-researched, which indicates that the younger the athlete who has their first significant injury, the more traumatic it is. And this makes sense developmentally for many reasons. The first thing that comes to my mind is it's a shattering of an illusion prematurely. And I think in some ways there's many wonderful protective factors to one's development by participating in sport, but there are also risk factors that are part of what we want to help to mitigate and minimize. But one has to do with this shattering of illusions. And so when you're a child and even a young adult, no one expects to become impaired physically or otherwise. And so to have that happen, it really interferes with that natural kind of grandiosity that one has with adolescent development. So that's quite a significant and interesting article to me, and something to be paid attention to. Another one is multiple surgeries. We all, I'm sure, are familiar with athletes who have repeated surgeries. Interestingly, just yesterday in a session with one of my young clients, 21-year-old young woman who has had multiple surgeries and is now recovered and back to sport. But we were talking about her experience of herself with the scars and those kinds of things. And it was interesting because when she associated to what her experience of her internal self is, because even though we objectively know our bodies are our bodies and they're not who we are, anything that happens to us physiologically feels like it's happening to us. And she used two words which were really striking. She said, I feel broken. And then she said, I feel tainted, which was really an interesting adjective. But my point in bringing this up is that these injuries that every athlete has, I mean, this is like a normative part of being an athlete. We get injured and we get injured again. That those need to be paid much closer attention to in terms of attention around the emotional experience of injury. Okay, so on with the risk factors. Decreased sport performance, maladaptive perfectionism in sport. These are risk factors, and typically the way maladaptive, what that means is perfectionism can work in favor of many athletes, and particularly in very technical sports. And when it morphs to being maladaptive, it has to do with the evaluative process of the athlete, like the striving to do better, the striving to meet these goals, all those things are fine, or having high expectations, but it's the evaluation of self that starts really hammering away at a person's self-esteem. And so that's where it is a risk factor unique to sport. And then, of course, there's certain sport-specific risks, concussion, eating disorder, weight-sensitive sports, and then transition out of sport, which has kind of organizationally been paid little attention to. And then environmental factors, which have been spoken about before, most notably non-accidental violence, which I think is one of those topics that people don't like to talk about. And it's also a tricky topic in terms of what's considered abusive coaching, what isn't. It's very tricky. But one interesting thing in research that I wanted to put forward is that the more elite the athlete is, the more at risk they are for being sexually abused. And so this isn't nothing, but you know, just in a nutshell, the reason that's the case is because they become increasingly isolated and then more controlled by adults. And the sexual abuse in sport is actually appalling, and it's really appalling on the club level with student children and students, and so for those of you in sport, you need to pay attention. Okay, next slide. Okay, so then path forward. So basically, our biggest hope, and Melissa is a champion of this, we want to get this information out there. We don't want this to sit in a journal or sit on a desk somewhere. And we want licensed clinicians, coaches, teams, institutions, federations to use this just abundance of information to educate themselves and then to move this field forward. One of the things that's missing, and this is certainly something to think about for coaches, is the simple idea of having a mental health emergency plan. Like, what do you do? You know, if something happens right then and there, and very few people have thought this through, like, you know what to do if someone's leg's broken or something hideous happens that way, but people really don't. I think they might intuitively know more than they think, but they get really freaked out about mental health and they don't know what to do. So it's important to know what to do and just to have a step-by-step emergency plan. It's important to create mental health services, have access, ease of access for athletes. That is just critical to make it easy for them to get to the providers, but then also to make sure that you're using licensed mental health providers and that the licensed mental health providers you're using are trained in sport, because it can be quite problematic with referrals to non-sport, really don't get the culture of sport. So, and then in terms of providers, to be a provider, you need to be quite flexible in your availability, both to the athlete and the coach and the organization, which means you've got to be willing to switch up your hours, to maybe meet on weekends, to just do whatever you need to do to make that access easy. And then there are particular considerations for psychotropic medications, which are very specific, but those are important to be paid attention to, because this is not something the general physician population knows. And many sports medicine docs are trained in basic psychotropic medications, but not necessarily what the particular downfalls are when it comes to athletes. And the same is true, I think, generally with psychiatrists. So it's important that this be paid close attention to. Next.
So now we're going to examine the structural components that we can intervene. So effective delivery of coaching education is more likely if it falls within the framework of coaching duties and expectations. And before I go further, this came from recommendations in the IOC consensus statement and also through the University of Toronto's research that we alluded to prior. So essentially what this first point is saying is that if, you know, the organization, be it a national federation or an institution at the university level, delivers coaching education, first of all, but then also, you know, has it fall within their duties and expectations that either continuing education for coaches or training is involved, we're going to actually start to increase more effective delivery, especially as it pertains to mental health. Resource allocation, priorities, and outcomes or behaviors that are rewarded show coaches whether or not mental health is viewed as an organizational priority. So the perfect example here is that win-loss record. So, you know, if a coach knows that the win-loss record is the bottom line, they're going to realize that mental health is not necessarily the highest viewpoint, perhaps, or the highest priority of either the coach or the athlete. So that could be a really challenging situation to balance both performance, but also recognizing the whole athlete experience and promoting athlete well-being. We also want to make sure to incorporate intentional time allocation in an athlete's practice schedule for learning positive psychosocial skills, and that's associated with better developmental outcomes. So, you know, a coach who takes time to work with their athletes on stress management or visualization versus just straight training from a physiological standpoint, they're gonna, you know, it's likely that they'll have better or more positive psychosocial outcomes as well. And then, of course, coaches, you know, that was our original big focus within our research. Still a big part of this presentation, just not the only point of influence where we can really make a mark. So with coaches, we want to foster team cultures that support athlete well-being. And some of our research noted this in a couple ways. I mean, one was to implement a holistic coaching philosophy. And what does that look like? Well, according to researcher Jamie Bissett from University of Toronto, Jamie uncovered a couple key themes, and that was coaches who emphasized athlete wellness. So that includes recovery, nutrition, if it's a university student or a youth, making sure they're considering their academics, and also their sleep. So that way the athlete knows their whole well-being is valued and not just their performance, their time, their win-losses. Additionally, coaches, you want to see coaches investing in relationships. We talked about the perceived power, potential power that a coach has in an athlete's life. And by investing in a relationship, it can help minimize some of those power differentials. We also would love to see coaches communicate that help seeking may require a temporary absence from sport, but reassuring the athlete that they can earn their position again if they're in a mental health situation that warrants time away from the sport. Also, scheduling regular meetings with athletes to build stronger relationships is a huge component. Like we talked about, that comes a little bit in that investing relationships, so that a coach knows, you know, if they're meeting regularly, if they get pulled suddenly in the coach's office, they know they're not in trouble necessarily. It's just time to check in. Additionally, another kind of layer here is addressing team hierarchies. So for teams that have, you know, cuts that occur, if you can have that transparent selection data, it can help, criterion, it will help an athlete kind of understand in a very measurable way what they can do to improve rather than, no conversation, which could perhaps lead them to not want to return to the sport again in the future. Providing skill development time in practice for those who receive less playing time really helps each athlete on the team feel valued, and that can help each athlete experience overall well-being in their time in sport. And we can also assign each athlete with a role that makes them feel valued. Oftentimes we think about a captain, but it can look like a variety of ways. It can look like, the teammate who's got a gift for singing and chooses to sing, for countries that honor the national anthem before performance, giving an athlete a role to acknowledge what skills they may have, whether it's leadership, whether it's creating team bonding activities. Maybe there's someone who's very social. So trying to just get to know your athletes and then helping them have a role on the team that gives them a sense of value and purpose. And then responding positively when addressing concerns from athletes. So hopefully by investing in relationships, that will open the door of trust, and that will be leading the coach into a position to hear concerns from athletes. And when that does happen, having the coach respond very positively, thank you for coming to me. Let's talk through this. And being that welcoming presence versus pushing it away because it's uncomfortable or it's out of my training, getting confident with that. And then also we want to see how to enhance the visibility of psychological or psychosocial distress. You know, this shows that by keeping it in conversation, or maybe it's a poster in a locker room, but just messaging around you know, psychosocial awareness can be a long way to just send the message that this is important. It's important for all of us to have and incorporate into our team and our well-being in this setting. So next, let's examine general culture setting as it pertains to mental health and athletes. So when we look at general culture setting, we want to consider positive role modeling. So for a coach, that looks like being able to actually live out your own ethos of mental health and mental well-being. We can always pick up when someone's just burned out, not that we ever want to make assumptions, but we can tell when someone is burned out or not taking care of themselves. And as the coach, who is that, you know, likely a strong role model, they can set the tone when it comes to mental health and wellness and well-being. So that goes along with tending to one's own well-being as a coach. Using inclusive language can go a long way in fostering experiences of belonging. And so being cognizant of gender identities and representation on your team can really go a long way in building trust with athletes to create relationships with their work concerns the coach would feel comfortable connecting. And similarly, building diverse coaching and support staff can increase the opportunities for athletes to connect with at least one individual. So, you know, if you consider that you're on a team and maybe you have a gender identity that is outside of the male-female, if you had a coach on deck who also identified that way, that person feels heard and seen. In male-dominated sports, having a female coach can really go a long way for helping a female athlete feel like they belong here and that they're understood and valued. So that's a broader consideration for coaches. So in addition to implementing a holistic coaching philosophy in general culture setting, let's also consider mental health literacy.
Thanks, Melissa. One of the most important things that I think needs to be really emphasized, and it's really become apparent listening to both Cindy and Melissa, is that coaches play such important roles with athletes, whether they be individual athletes or on teams. And I think that can't be underestimated. I think that's so important. And I think it's something that ought to be underlined and literally put a box around, because they are perhaps the most important individual in setting the tone for the team's dynamics, how people get along. And I think that is really important in really creating pathways to support. And Cindy has alluded to this already. One of the biggest findings that we've had, especially from the consensus statement, is the power of the plan. If there is an emergency plan available to the coaches and to the athletes, individuals are more likely to be able to even know where to go. And that's something that has come out in our literature, in our studies, looking at mental health literacy with coaches, is that those who know more about not necessarily symptoms of mental health symptoms and disorders, but in terms of where to send people, how to connect them to these kinds of services, actually experience greater well-being and lower symptoms, mental health symptoms and disorders. And so it's important to recognize the power of just information about where someone can go for support. And it can be just having potential connections with a team. It can also include things like what to say when you go and see a mental health provider, how to access them, what kinds of support services there are, how in certain countries payment becomes an issue, how does that become negotiated. That kind of literacy about these pathways to support play critical roles in ensuring that individuals actually get the support they need. And continuously within the coaching literature, it really needs to be emphasized that they are so important. But coaches also experience profound stress. And so the number of stressors that coaches face, whether it be organizationally or from other athletes or other coaches, in addition to their lives, are profound. I think it's in the hundreds, actually. There's been some work that's been done by folks at the University of Portsmouth in the UK who have looked at coaches' tremendous number of stressors in their lives. And so that cannot be underestimated. And here, although coaches play this kind of important foundational role, what cannot be negated is the organizational responsibility to help coaches. Coaches cannot carry this alone. The kinds of points that Melissa made in the slide prior to this one, and the kinds of points that Cindy has raised are absolutely spot on, and they're really important in terms of the kind of dynamics that exist on that team, how we can improve the play, how we can make things inclusive, the language used. All those things are important. But what cannot be negated is the ecological view of health on this team. And that encompasses physical, psychological, and social health. That this responsibility does not begin and stop at the coach. The coach cannot literally carry a person to a provider. These services, including these kinds of emergency plans, need to be taken seriously by organizations, whether they be actual teams or perhaps entire sports or entire leagues, or even entire sporting organizations, like, for instance, the NCAA, which, by the way, does an incredible job, or the IOC, ditto for them. We need to think about things through an ecological means of delivery, that we have proper policies in place that then provide the opportunities for organizations to create pathways, these emergency pathways that Cindy spoke of, and literally falling within the capability of coaches to direct athletes to. Mental health literacy has evolved, much like health literacy. It has moved from people reading pamphlets about various symptoms or how to take pills or how to do all sorts of things, to one that is now a proactive strategy, one that builds agency, that allows individuals to do something to prevent as well as to react to poor mental health. So mental health literacy is a very evolving construct, but one that gives people a lot of power, which is the theme for this conference.
All right, so whoops, am I on mute? No, I'm good. Okay, so basically, this is thinking about how coaches and kind of the culture of the context, the cultural context that a coach is in, kind of how to fight the stigma and of mental health, because it's alive and well, and it's alive and well in general in our cultures. It's not just in sport, it's perhaps more intense in sport. But the point to me is how to figure out just a way to have this be a normative conversation, how to have it not just be an open dialogue, but something we can talk about just like we would talk about, oh, my sprained ankle or this or that or the other thing. And so what coaches can do in terms of shifting the culture of their team is to very intentionally include mental health as part of team conversations, just the same way that it's talked about in terms of other ways to take care of yourself, that this is just part of what one pays attention to, which of course also involves the buy-in of the coach. And trust me, I've seen many coaches in therapy and other administrative personnel in athletics, because it's a very challenging culture to function within. And so to the extent coaches can also look in the mirror and embrace this idea for themselves, I think it goes a long way. Another crucial part, which perhaps has the most valence because people can wrap their head around it, is the way a mental health condition is like a physical injury. I think it's very hard because in some ways mental health is kind of this abstraction, and we can't just point to something on our body to then say, well, this is what the problem is. but to somehow help people understand it's like any other injury. And when our brain and our heart is hurting, we're injured, and that it involves intervention and it involves recovery. And it goes through all the same steps that a physical injury does. But it needs attention. And typically, just like with injury, the earlier the intervention, the more likely it will resolve earlier. That's just a fact. And I'm really grateful. At this point in time, I'm working with a very mental health savvy sports med doc who is referring me a lot of athletes, in a sense, almost preventively, versus, what would happen many, many years ago, where by the time I got the kids, they were very, very ill in terms of their mental health condition. So again, taking care of mental health, it's a normative part of what you do and what you do with your teammates. And to me, it's just something we should be able to talk about. And again, as a coach, to hold the expectation that the athlete will communicate with them openly about their concerns. This, of course, means the coach has to be open to hearing about it, but let's assume they are. And knowing that the athletes are going to be frightened, because they are. And that's where the literacy around what mental health needs to continue to increase, because we can say all we want about the athletes afraid because they're afraid it's going to shift how the coach views them. But the fact is it does. And so unless the coach is mental health savvy with their own experience or family members, it does change how they think about things. And so then it's about working with the whole to help people be able to just talk about what is going on with them at any particular time. We also need to underscore that a couple things, that athletes are going to underreport for all the reasons that we've said. It's just part of the culture, the lack of complaining, the toughing it out, all these things you're very familiar with. Another interesting thing relative to mental health, and this is really interesting in my treatment of athletes too, is they're used to tolerating a great deal of discomfort. And so frankly, by the time they're going to bring out an anxiety or depression concern, they're likely highly symptomatic. And so, but they're used to standing hard feelings. And so that's really important to appreciate too. And again, certain mental health conditions can be life-threatening and need addressing, not minimized or dismissed. And, in some ways, even though people don't think about depression as a life-threatening condition, it is. I mean, in its worst case scenario, someone kills themselves. Well, there you have it. And so I think we need to take this very seriously, just like we do cardiac issues in athletes and other issues. Okay, next slide, please. All right, so part of what I think is really important just in terms of shifting the culture is looking at illness and wellness on a continuum, because our culture in general in the US and athletic culture for sure is binary, like there's this or there's that. And the truth is how we feel changes sometimes day to day, and sometimes within even a given day, I can feel quite different in the morning than I do in the afternoon. And so what we want to do is have ourselves and our athletes functioning within this wellness paradigm. And of course, ultimately, when things are going well for us, we can thrive and we have a great deal of resiliency, and we just have so much traction and we're just moving our lives forward. Then we're inevitably going to have periodic ups and downs. But of course, the more resiliency we have, the more likely it is to be able to weather those inevitable ups and downs. But then there's sort of this point where it shifts over to where you start seeing some functional impairment. And what that means is we can start seeing inconsistencies in performance. We can start seeing inconsistencies in mood in our athletes. We can start beginning to see increased somatic complaints or somatic conditions that aren't resolving in the way one would expect them to. Those are going to be some of the functional impairments, or you start seeing maybe athletes withdrawing a bit from teammates, not necessarily wanting to participate. That's when it's starting to affect our functioning. That's really when we all need to pay attention both to ourselves when that's happening to us, but also when that's happening to the athlete. Those are just simply signs. We don't want to just ignore the signs. And that's where athletes will, because they're used to tolerating discomfort and they're going to try to tough it through. But then before you know it, there's severe functional impairment. And so that's part of, I think, as all of us in sport and just in our own lives, this is a really useful paradigm to think about and kind of where we're falling. And we want to like not just be neutral, though neutral should be the worst we are, but then kind of know how to get to that middle ground and then continue to move forward. Next slide. All right, so this is about how to have conversations. And of course, I'm speaking particularly in reference to coaches, but this is frankly true for anyone, because you never know when you're a person, an athlete or even a friend comes up to want to talk to. So the important part, if you notice something's like up with an athlete or they say, can I talk to you for a minute? Just make sure you're in a private space, because honestly, we never know really what's going to come out. And it's important to respond to what the person's saying. The best thing to do is simply to listen and express concern in non-judgmental terms, and not to minimize or become like hysterical, like frightened of what they're saying. But just basically by, in a sense, holding the space with them to listen to their concerns. I cannot tell you how far that goes for any of us, and not moving in too quickly thinking you need to fix it. So basically you want to listen in a non-threatening, meaning open and empathic manner. And oh my God, this is jumping all over. Am I doing this, Melissa? Something weird's happening.
No, sorry, it got bumped on my desk.
Oh my God. All right, well.
Here we are.
Thank you. Okay. All right, so, and basically to empathize, and you do, and empathy means that you're basically listening to their experience. And so it's different than sympathy. It's important to empathize and just kind of be there holding them in their experience and not trying to move in with anything really. And then in a sense to normalize, like, you know, this is not uncommon. You're certainly not the first person to feel this way, but not to say something like that in a dismissive way. Like, oh, other people feel this way, so don't worry about it. Not that way, but more normalizing it. Yeah, that this is human, this happens, and let's just figure out what to do. And so again, to refer, so first to be able to refer, you've got to kind of know step by step what you need to do. And that's where an emergency plan comes into place, because basically what I'm describing here is a fairly straightforward, asymptomatic, in a sense that the student isn't unraveling exchange. And but also what can happen when people have been holding things in for a long time, they could completely unravel and disintegrate. And then typically non-mental health professionals have no idea what to do. And so it's good to just kind of have a game plan, and what do you do when an athlete's unraveling, and all those kinds of things. And also I think coaches, you know, obviously they're human beings and they want to help, and sometimes they overstep the scope of their role or their competence. And all of us as professionals need to be aware of what role we play in the athlete's life, and to work together with whatever the support team is to make sure we're staying in our lane and not doing things that in a sense are confusing or undermining other people. And then frankly, coaches need to follow up. It doesn't just need to be a one and done situation, like the athlete gets referred, but just to check in periodically, like just how are things going. And because people just want to know things are going okay, and they can say, oh yeah, no, I'm meeting with Cindy, it's great, or whatever. And then that's good. To just, athletes need to know you care. Next slide. Okay, this is basically redundant, but I just want to underscore a few particulars. And again, that mental health is as important as physical health. And to me, I don't even like making that distinction. To me, it's our entire being. Mental health is sort of viewed as other. We have our well-being, and then we have our mental health. Well, mental health is our entire self. And then to build rapport with athletes on a continual basis, to again, just have these kinds of concerns and openness is just part of what you do. And then again, being aware and promote inclusive language, particularly respect for gender pronouns, which we know is really shifting in our culture very rapidly. And just to help athletes who may experience multiple forms of oppression via what Melissa talked about earlier. These aren't nothing. And this becomes quite an invisibly painful experience for people. And again, to be sensitive and aware of potentially harmful language. I mean, everyone thinks that everyone knows this, but like, don't use words, particularly with women and particularly with young women, like fat or large, or you could lose a few pounds, or, I mean, you know, I can't tell you like the kinds of hideous remarks that are said flat out, currently said to athletes, that if you don't lose this, you will not compete. I mean, it's just that straightforward, but none of that will really ever be helpful to anyone. Okay, so I'm sorry, my slide's getting all weird. Okay, all right, so going forward, this is again a cultural shift in mindset that is tough in athletics, because of course we want to win. That's what athletics is about. It's about winning. And so it's really easy to talk about achievement and to consider achievement as an end point, which isn't to say it isn't. Because of course we're working hard to win. Of course we are. We love to win. But that in workouts and in the general culture, to de-emphasize achievements or singling out the most capable athlete, which has its own burden for those athletes. You just need to see those in your office, and they're as burdened as the one who feels left behind. And de-emphasizing achievements and outcomes, and instead foster a growth and development mindset to emphasize like effort and improvement and working towards and acknowledging, of course we want to win. It's not that we have to pretend that isn't true, because of course that's stupid, but because it is true. But that's different than having it be the only thing that matters. So working with parents of any athletes, but elite athletes, particularly children, I think this is very tricky. It's something that I find quite painful, but that we need to pay attention to in terms of children's needs unrelated to sport. You know, I'm seeing young adults, mostly my population is between 18 and 30. And it's really astonishing how underdeveloped other parts of their selves are. And I'm not just talking about emotionally, I'm talking about literally. Like many of these athletes who come from quite privileged homes, finish college, and they don't even know what their other interests are. They've never had the chance to honestly experience or explore anything else, whether it's art or music or travel or history, or they don't know. I mean, they literally will say, I don't know what I'm interested in. Well, that's an incredibly impoverished place to be in at the age of 23. And you are way behind the curve of your peers. And they feel it when they're done with sport. So this starts with the parents, though, is to not to allow children to explore other aspects of self and not have everything be about their exceptional talent in sport, which of course, you know, all parents are going to be all overstimulated by. And again, to communicate the importance of the whole care of the child, which in a sense, if one can help parents do that, they're literally helping with the mental health of the child. And then teaching athletes as they develop the power of self-efficacy, like how do I, and that's tough in sport, because as a autocratic system, it's a top-down system. It's hard to know, when do I have a choice around asserting myself? That's what self-efficacy is, and advocating for myself. But just to have that be a concept of part of what you have to learn to navigate the world. And again, the importance of resilience. We hear that word a lot. I think it's trickier to figure out how to implement that. But basically, I like metaphor. It's having gas in the gas tank. And the truth is, we can have a perfectly well-working car, but if there's no gas, it's not going. And so that's part of what we have to figure out. How do I get refueled? Because most of the time we're just putting out and there's little coming in. And then, of course, determination around using the determination that they have to be successful in sport. My athletes that really recover from their mental health conditions are incredibly determined. And so it's about using that determination to apply to any aspect of your life that matters to you. So.
Thank you, Cindy. So now we've got some great strategies, not only for coaches, clinicians, and structural levels, but we want to also consider the larger level national federations, sport organizations, and institutions like universities and colleges. So what can they do to foster within their programs an environment of athlete wellness? Well, a few strategies include requiring mental health training and certification programs or continuing education. So to remain certified as a coach, requiring coaches to take continuing education, and making sure that some of that is mental health training, mental health first aid. There's a lot of resources out there. Emphasizing the structural recommendations from the IOC consensus statement in coach training and certification. So again, we're kind of tying in this big piece of literature and applying it to what our local sport is, the context of our local sport, or the context of our particular nation, context of our particular university. And then as Cindy described the signs and symptoms, we want to then train our coaches to work within our sport organization or institution to understand and be aware of the signs and symptoms so that they can be, knowing they have that such quality time that they're spending with their athletes, that they can be in a prime position of knowing what to look for because they've been trained. Providing diversity, equity, and inclusion training to help coaches foster atmospheres of inclusion can also go a long way in building that trust. Again, knowing that athletes may experience different mental health challenges in light of intersectional oppression. So that is a really important piece as well. Additionally, providing guidance on how to build a mental health support team. Cindy talked about some of the action plans. As part of this, each university and each institution, each club, each team, they're all going to have someone different that might be best to reach out to in their local area. So giving your coaches training on who they should reach out to at your university, who they should reach out to in your school, really localizing it can go a long way. Additionally, promoting athlete well-being and platforms for athletes to share their stories. One of my favorite examples is with USA Cycling, which is the national governing body of cycling in the US. They have a whole platform of a blog from different athletes and coaches who just share their experiences in the sport. And it's one more way to help folks create a way to be heard, but also to share some stories to really open the door to conversations around mental health so that it doesn't have to be a hidden issue. And additionally, we can take the step to monitor and evaluate coach and athlete self-efficacy in knowledge, attitudes, beliefs, and help-seeking intentions toward mental health. I imagine in this climate, many of us don't have the additional resources to conduct this type of research, but if we could, being able to kind of measure these specific areas and seeing if these trainings are resulting in greater usage of mental health or greater conversations can help us really get a benchmark on how this is being implemented and to what extent. So in addition to these strategies, we also want to make sure that coaches are implementing developmentally appropriate training. So really the sport organization sets the tone in their coaching education to make sure that the recommendations and training they're giving are appropriate to that athlete's developmental and life stage. So this not only ensures that the skills they're using are rooted in developmental milestones, but it can help mitigate injury. And then it can also help increase the athlete's self-esteem because it's based on what the athlete can do from a motor skills standpoint at that particular age and time place. So next, we're going to explore some examples about how other countries have implemented and created coaching policies and programs.
This is me. These are just some examples that I quickly put together. And one of the things that I really want to emphasize is that within training for coaches, especially in the UK, it is something that is taken, I think, extremely seriously, and it is something that has certainly evolved. And one of the things that I want to just kind of point to is in your top right, these kinds of 5 pillars of duty of care. What you'll notice are these factors that have been discussed continuously by Cindy and by Melissa in terms of these underlying factors that either promote good mental health or are quite destructive when there are challenges that are experienced, say, with safeguarding or anything that has to do with harassment or abuse, or if there are perhaps issues around inclusivity within teams, or we don't recognize the diversity of individuals, be it along a number of different characteristics. So it is really important to take note of this. And you'll see that within those 5 pillars of UK coaching, well-being and mental health take prominent roles. So they recognize the importance of individuals flourishing, of being able to handle stress, of being able to contribute to their own development, but also that of their community, and well-being, being able to not only recognize challenges, but have the resources to do something about those challenges. And this applies not only to psychological health, but also physical and social health as well. One of the things that I really wanted to kind of point out is also just below that. It's on the bottom right there, the kind of implementation plan that I clipped for. This is kind of like house league. I'm trying to think of Canadian terms that people would use, intramural things that people would recreational type of play. So even for coaches to participate and to lead non-elite athletes, the level of training that is required in the UK is actually quite high. And it's only going to become even more regimented. And so this is just an example of what's coming into effect for certain sports from 2022. As you can see that there's a certain age requirement, there is also certain training that is being endorsed by the Chartered Institute for the Management of Sport and Physical Activity. There is a DBS check, which is a disclosure and barring service that makes sure that individual's criminal record is checked. I mean, that is a whole other can of worms that you can open up in terms of the criminal justice system and individuals' inclusivity in sport. But for all intents and purposes, to keep this a condensed conversation, I know we're running long in the tooth on time, but things to kind of be mindful of in terms of addressing the kinds of underlying factors around mental health. So within recreational play, within elite level play, which you'll see on the left-hand side of this on the screen, there's so many training opportunities to help provide coaches with opportunities to learn. And one of the most important things is that, you know, we are creating pathways to provide support. Coaches have a lot on their plates, and this can only be done in unison with leagues, with teams, and it is something certainly that coaches cannot do themselves. So the training is there, certain skills are being taught, that kind of literacy is being improved on an annual basis, I would argue. But one of the kinds of things to really think about is administratively within leagues and teams, what's happening there to really help the well-being, mental health of athletes, coaches, and other individuals in the arena. We don't have time to talk about, say, match officials or umpires or referees, but the collective well-being of everyone certainly needs to be addressed, and situating ourselves with an ecological perspective allows us to think about that.
So before we fully close, just wanted to reiterate a few key points from our discussion before we go into some Q&A. And the first is that addressing elite, or not just elite, but athlete mental health goes way beyond the coach-athlete relationship, though that is a really important relationship to work on to help cultivate, since coaches spend a significant amount of times and have a significant role in their lives of their athletes. Institutions and national federations must also be engaged to address the systematic and structural aspects that can help cultivate athlete well-being. And so whether you're a coach, a provider, a sport organization, or an institution, we all have a responsibility to talk about and get trained in mental health, incorporate mental health training, and create action plans so that we can foster healthy sporting environments while being prepared to work with athletes who may disclose mental health experiences. And I want to close with a short story, a personal note as to why this topic is so close to my heart. In my family of origin, I grew up in a home where there was addiction. And as a young child, I used to write in my journal, after swim practice, no one can tell if you're crying behind your goggles. My teammates, my coaches, and sport itself quickly became my support system. And this led me to pursue swimming at the Division I and NCAA level in college. About halfway through college, my coach noticed that my usually cheerful demeanor was fading. I wasn't sleeping well, I was overextending myself on top of my swimming and academic commitments. And I was later diagnosed with generalized anxiety disorder. And so I began therapy. And while I still faced mental health challenges, I made it to our conference team and earned a program top 5 finish in the 200-yard butterfly. All of this was because a coach was willing to sit down and talk with me. My positive sport experience and then getting into mental health care is what has allowed me to continue my journey in sport and triathlon as an adult. And I now use my platform to address mental health and gender equity within triathlon, and not only within my own sport, but those whom I coach. And I know my story is not unique. I imagine each of you, or perhaps yourself, may have experienced mental health and mental health challenges. The words of a coach and the sports governing bodies that oversee sports in which our coaches and athletes engage with each other has an opportunity with every interaction to either build up or turn away, to empower life or to ignore the challenge. We hope that these strategies will provide clear frameworks for things that you can implement on a variety of levels with those you come in contact. So thank you for being a part of this conversation. And at this time, we have about 7 minutes, I believe, for Q&A.
Fantastic. Thank you so much, Melissa, and thank you so much, Paul, and thank you so much to Cindy as well. It's unfortunate with this format that we don't get to share our gratitude to you via applause, but I trust that all of those in attendance are applauding right now. So I would like to open this up to questions. You are free to use the chat function. You are free to raise your hand via the part on there, the participant list there on Zoom. If you're familiar with that process, you just click on raise your hand when you go to the participants list, and I'll get to you as soon as I see questions here. So we have some words of congratulation here from Jameson Ryan saying, thank you so much. That was fabulous. I'll start things off with a general question from myself, if that's okay. I'm curious about the role. I mean, there's such amazing detail offered here about the role, obviously, of coaches and the various kinds of coaching. But I'm curious about, in a team sports setting, the challenges where you have team authorized or team sanctioned mental health professionals that sort of work for the team, or team doctors in some senses. What are the challenges in sort of interacting with team officials when they're sort of sanctioned mental health professionals, and their sort of conflicts of interest that can arise when it comes to return to play protocols and things like that?
I'd like to speak to that. First of all, I think one of the things that needs to get clarified is that often professionals, sports psychology professionals who are working with teams are not necessarily licensed mental health professionals. And it's important that that get distinguished between sports psychologists who are performance only, and then there are sports psychologists who also are clinicians. It's a hybrid role. And so it could be that what you're referencing is what's basically a performance only coach, and they shouldn't be dabbling in mental health. So I just want to make that clarification, because I think it's a point of huge confusion, and it's one that has to do with mental health literacy. But I think you're talking about a conflict of interest that, I mean, it just goes without saying that when you work within sport, and I know for myself, you know, I can't ignore knowing when I get an athlete that's very important to a team, that people, the hope is that they'll get back to play. But that being said, it's important that providers view their client as the person, and not to the exclusion of their athletics, but that it's important that we figure out what's going on with them. And then there are return to play protocols, and those need to be followed ethically, just like with anything else. And so I don't know if that helps, but you're raising a good question, and I think the conflict of interest is troublesome, potentially.
Perfect. Thank you so much. And I'd like to ask a question here from Kevin Witherspoon. What do you think are appropriate penalties for infractions in the mental health arena, particularly at the college level? With so many positives from sport participation, is it appropriate to suspend or even give, quote, the death penalty in cases where coaches or support staff are abusive?
Well, that's a lovely question, but that's a slippery slope. Partly because there aren't overarching expectations. Again, that's where UK is doing things, and Europe's a bit ahead of the game, quite a bit ahead of the game than in the United States, where there's no standards for who gets to coach. And there's no overarching expectations that need to be followed. And then there's within any organization, whether it's a club team or a college team or a high school team, I mean, they're just, it's basically been ignored. And what's, you know, honestly just unbelievable in athletic departments is, even though, again, within the culture of sport, I get it, but how the kind of language and the way students can be treated in the athletic department versus any other department in a university, where the person would be fired on the spot. So, I mean, that's a good question, and I think it's an issue that needs to be addressed, but that's a big one. I don't know, Melissa and Paul, what do you guys think about it?
I think I think you raise a really interesting point, Cindy, in that this becomes an interesting slippery slope. That you know, I think this is where you really need to think about the responsibilities of leagues and teams and overarching policies that govern harassment and abuse or non-accidental violence. And that needs to be taken extremely seriously. And it's something that cannot just, again, sit on the shoulders of coaches to kind of self-govern. Even with the highest levels of training within the UK, for instance, for any kind of play, there needs to be good organizational structures. And I think that cannot be underestimated. Yeah. So I think that we need really good policies. I think we need really good reporting mechanisms. And I think we need perhaps, actual mechanisms to monitor what's going on teams. You know, we can have the best intentions, we can have the best screening mechanisms for who gets in to become a coach. We can do all sorts of, you know, background checks and things like that. But if we don't actually have good policies in the league to monitor what's actually going on, you're going to miss all sorts of acts of harassment and abuse. So I think this really emphasizes what we talked about collectively throughout this talk, which is ecologically, there's so many opportunities to intervene. And I think that the organizational as well as policy level structures cannot be underestimated.
And within the US, within the national federations or national governing bodies, is how we use it in the US, there is a program called Safe Sport where an athlete or a coach can report a concern of a violation, and that will get investigated and could have repercussions like suspension from the sport, where warranted. So there are systems in place, but it sounds like the big theme I'm hearing amongst all of our experiences and responses is that it's very fragmented. There is no one standard way to do it. How to report, which is why I think maybe people don't report, because there's no clear answer of what the best way to do it is. So I really appreciate that question. I think it drives home the need to create some more systemic change in how we actually broach reporting and have standardized actions.
Fantastic. And a note from Cheryl that says, "Thank you. I'm not a coach, but I've still taken away so much about how I can interact positively with athletes." And a question from Alex Diaz. It's more of a comment that says, "Recent studies in neuroscience supports a holistic approach towards mental health rather than just focusing on using cognitive approaches. Curious to hear your experiences."
Well, I can speak to that. I mean, basically, I know it's recent studies. Neuroscience is now, because of where the discipline is now able to show brain imaging for what Freud knew 100 years ago. And basically, I mean, I've always done a holistic approach to my work with athletes, and what I'm hoping, Alex, is that there's going to be a swing back to that, because there's such a limitation around cognitive approaches if one isn't dealing with the underlying issues. Cognitive approaches are powerful. I use them all the time. And basically, I do an integrative approach that I'm not just appealing to someone's cognition, because if we could think ourselves out of how we feel, man, we'd all be cured. And so it just isn't that simple. And so hopefully, I mean, I've been in this field a really long time, so it's swung way over here to cognitive. I'm hoping we're going to go back to something that's more integrative, which I think is what we're here doing. Yay.
Fantastic. And I will turn this over to Andy, who has a question as well, and I'll unmute him here. See if we can get him muted. There we go. Andy, ask your question.
Is my audio okay?
Yeah, a little scratchy, but we can hear you.
Okay. So my question speaks to what something that Cindy said in the presentation, but I would like all to answer if that's possible. In the presentation, you mentioned that sport is a quote, a very difficult culture to function in as a coach. One comment I'd like to make is that one of the things that I think makes it difficult is that many athletes have multiple coaches, not only throughout their career or lifetime in sport, but even at one singular time. I played football for several years, and I would have a position coach. I'd have the offensive coordinator, the head coach, the trainer. I'd have all these coaches at my disposal for various functions. So I was wondering if you could speak to how this complicates the objectives of what you have presented to us today and the IOC consensus statement.
Were we able to hear that question okay? Could we hear through the scratching?
Yeah. I'll start, because I think it's actually something that I would think we all talked about it, but it's having a plan, and the greater the organization structure that exists resolves that. So clear planning as to roles and responsibilities and what to do when, say, mental health symptoms and disorders become known to, say, I mean, there's always going to be a head coach of some sort. And so there needs to be some sort of structure in place hierarchy, for instance, that dictates roles and responsibilities and how that is acted upon. So I think, again, Cindy really talked about the emergency action plan or emergency plan from the IOC statement, but that cannot be underestimated.
Was there a part to that question you wanted me to address, Sandy? I wasn't quite sure.
Stunned silence, Cindy.
Well, I just wasn't quite sure. I couldn't hear it well because of the crackling. Okay.
I think we lost Andy.
Yeah, I think so too. I just wasn't quite clear what the question was.
It was about multiple coaches for athletes that have coaches that are perhaps a skills coach. You see this in
Sure.
team sports where you might have more than one messaging being distributed there in terms of, you need to work on this, you need to work on this, you're too fast, you're too slow, these kinds of multiple messaging and what kind of effect that can have on an athlete.
Oh, okay. Yeah, well, there are many complications to be an athlete that's working in, a competitive environment. And I think, he stated it. It's a lot. It's like, who's your master here? Like, who am I supposed to listen to? And then, of course, you throw in the United States being a student athlete, and you've got so many people that you feel like you need to, in a sense, please. It becomes very overwhelming. And I think, the point I'd like to underscore is we're talking about young people. We're talking about kids, essentially. And so to ask these kinds of basically demands of people who are barely like even coming into their own in terms of their identity, in terms of their sense of themselves in the world, is asking a lot. It's a very fragile and vulnerable time that I think is really not paid enough attention to.
I think in triathlon too, there's a lot of, one athlete may have, a triathlon coach, then they may also work with a cycling coach or a swimming coach. And there's so many fragmentations and expectations. And I think that's where a national federation level approach to what are our expectations for coaching? How can we set the same tone so that, hopefully what's reinforced in one type of coach's curriculum is reinforced in another. Because right now I think that speaks a little bit to the fragmentation too of what coaches receive in their type of training.
Well, that's fantastic. Thank you so much. I think we're so lucky to have shared this much time with you. And again, I really do wish that we could share our gratitude via applause, but we're all applauding right now. And we want to sincerely thank all of you for your time and thank all of you who've asked questions and provided comments. And thank you so much. This has been highly successful.
Thanks, everybody. I'm going to skedaddle. So it's lovely to chat.